So we not recommend wearing contact lenses with any water activity in general. And I know, specifically during the summer, we think about being at the pool or, if you're close enough to a body of water, right, you're at the lake or the ocean. You don't want to see blurry when you're doing those activities. But I always tell my patients that, you know, a couple of hours of blurry vision is worth it compared to a lifetime of blindness. And so there are microbes that live in the water. Kind of think of them almost like little parasites that acanthamoeba is one of the biggest ones that normally they're not so bad for our eyes, but whenever we're wearing a piece of plastic, that contact lens, that acanthamoeba can sort of just attach itself to the contact lens, and it says, "Oh, we've got this nice environment. It's warm, it's wet," and then it starts, kind of just this big infection on your eye that is really hard to treat and can take a lot of time to treat. Eye drops, sometimes even IV medication and things like that. And in the end, it potentially can result in just a really big scar on the front of our eye. That so we think of blindness, but really the scar is what's causing the blindness. And so you potentially need a corneal transplant, or you kind of go around life with a lot poorer vision than had you just spent a couple of hours without your contacts in when you were in the water. And that also applies to showering too. So if you're going to be showering, we do recommend taking your contacts out, or hot tubs, basically anything with water. You don't want your contacts to come near it.
So I know exactly what my nightmares tonight will consist of. Terrifying. So maybe don't do everything Joyce does, because I was on vacation recently with my contacts in, but